The anal fissure is quite a remarkable problem, isn't it? I mean, you get a cut anywhere else in your body, your hand, your eye, your head, and the body heals it with no issue and with minimal care. But what about a cut in your butt? I mean, all of a sudden now the body has all these issues? That's what I want to talk about today, give you my formula for healing a chronic anal fissure. Hi there, I'm Dr. Chung and I'm your friendly proctologist. Thank you so much for being here. I welcome you to this space and community. Check this place out, check the comments out, and while you're at it, please give a like and subscribe to help this community grow. Also, if you're looking to have me involved with your care, I do provide video consultations for anyone interested. Just email me at yourfriendlyproctologist@gmail.com to receive all of the details. Before we get into my formula, I want to point out two foundational ideas. Number one, an anal fissure is a break or a cut in the lining of the anus. You can have one, you can have multiple of them as well. Number two, I make no distinction between an acute anal fissure and a chronic anal fissure. In the textbooks, they want to make a distinction between the two. An acute is 0 to 6 weeks old, and an acute is 6 weeks and older. To me, it makes absolutely no difference. A cut is a cut is a cut. You've got to figure out the reason why the cut is so bothersome and lasts for so long, right? No one comes to me in the office for a fissure that lasts a week and disappears. No, not at all. So let's talk now about how to get rid of these things. Please let me make an honorable mention to the sponsor of this channel, which is Revival XR. Yes, they have created an innovative solution to sitz baths because this is comprehensive. This is the only thing you'll need to buy, and they sell it right now on Amazon. Use the discount code, please. They have offered it to us. Thank you to Revival. But what is this stuff? It has got your salts, your Dead Sea salts, Epsom salt. It's got your oil, coconut oil, calendula oil, and it's got herbs and vitamins, right? It's got vitamin C in it. It's got your aloe vera. Everything that you're gonna want in there, this has got it. This is what I love to use in my bathtub for my itching, for my hemorrhoids, and when I get them, especially after bannings, this can be really, really calming to my anus muscles. And of course, anal fissures like we're talking about today. Try them out to reduce the inflammation, to bring that relaxing and open up your muscles so more blood can get in and heal yourself. Again, get it on Amazon. The coupon is down below. Thank you, Revival. I want to now explain my system or my care plan by kind of taking you through a patient guided scenario. And I'll tell you, first of all, my visits are very, very unique to do all the things that I do, okay? Usually if you have an anal fissure, the typical doctor spends about 5 minutes with you and tells you to take fiber and do a sitz bath and go home. That's not what I do here in my office. I really tease things out. We have time to ask questions and respond and delve deeply into your issues. So, at the first visit, I diagnose an anal fissure. I can see it 100% of the time, pretty much, like 98 to 100%. I can actually see the cut that's bothering you. And that's very helpful because if I don't see it, then we're still wondering, well, what is the pain that's causing you all this trouble? And the first thing that we've got to attack is your stool textures. Yes, this is the most common offender, the most common reason why your fissures refuse to heal. Refuse to heal is really the wrong word because they cannot heal. We are not allowing them to. The environment is so bad. The anus is saying, dude, I don't know what you're doing to me. Stop it already. Stop giving me the big, wide, and hard, lumpy poops. Please, please, for the love of God, give me smooth, nice, gentle, easy, slow poops. I don't want diarrhea. That stuff messes me up too. Can you please keep it at a regular basis? Like, don't be skipping me with, hard and diarrhea in the middle every other day. Please just give me a nice 2 weeks of soft poop, and I promise you, your troubles will all be over. Okay, and I hope I brought that point home there. But one thing I want to specifically focus on is fiber supplementation. Yes, I know the internet, your GI doctors, your family doctors, your surgeons, your nurses, blah, 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 will all preach to you about increasing your fiber intake. Heck, they'll sell you fiber from their doctor's office and say this is the stuff you need. I am not against fiber. However, you should use it appropriately. Find the right amount that your body needs. If your body needs only this much, like a teaspoon, don't take anymore. If your body needs this much, again, don't take more than that, okay? You can overdose on this stuff, and I find it to be one of the most common offenders for giving people grief. Don't forget also about comet poops. Registered trademark Dr. Chung. It's the kind of mixed textured poops where in the beginning inch of the poop, it's a little bit more firm, a little bit wider, and people typically need to push a little bit harder to get it out. But when it does, it usually pops open the fissure because it's rough, it's wider, you gotta strain a little bit harder to get it. And then the last part is usually this looser, very, very soft type of poop. Completely opposite. And the problem with it is that the stool comes out so blazing fast and so rough like diarrhea. And your anus isn't able to slow it down. You're not able to stop straining in time because it came out of you in 0.002 seconds. And I'll tell you, your anus hated the entire experience, and I'll tell you, it's no wonder that your anal fissures are still sitting there. Of course, we've also got to talk about your diet. We've also got to talk about your activity. How well do you do with hydration? Do you need to take a stool softener medication or supplement like magnesium citrate and the like? There's a million out there to decide from. The second topic I always make sure I hit is your toileting habits. What are you doing when you're in the bathroom? From having the poop, are you relaxed? Are you sitting down? Are you squatting? What are you doing? And then your wiping techniques. You know, are you scrubbing hard? How many tissue papers do you need to use? Is your skin on your anus healthy, or is it roughed up and got thick skin, armored like a turtle would? But those habits can definitely be very damaging to a fissure. Whether you're scraping it manually or you're straining hard, you're pushing hard, you're not able to relax, and the poop is scraping the inside of your anus, and no wonder you've got wound issues. The final thing we need to hit in the last visit is to try one of the anal fissure creams. Yes, they should definitely be attempted at some point, and nifedipine, diltiazem, nitroglycerin, any one of those really. I'm a bigger fan of diltiazem, but that's because nitroglycerin gives a lot of side effects, okay? And I'm kind of biased because I find that it helps most people. The cream should be used up to 4 times a day. Try to use it at least 2 to 3 times a day. Once in the morning, once before bed at least. But that can definitely help relax your muscles just a tiny bit in order to get more blood flow and heal these wounds faster. The final thing before we all end the visit is, of course, the patient has a bunch of questions, right? Want to know about your workout activities. Want to know about this vacation that I've got coming up. How about this food? And how about that diet practice? Of course, these are excellent things to talk about because, yeah, they may actually be surprisingly a reason for your fissures to persist. I am surprised every time, but that's how diverse and different we all are. It's really the beauty of the human race. Not that anal fissures are beautiful, but you know what I mean. The aspect of taking an individual person and treating that individual is very, very important. Now the patient will go home and they've got tons of things to try and different strategies to come up. They might even go online and look for other strategies, other tips that people are using. I'm all for it. Go ahead and try it. If you are safe with it, your doctors are okay approving of it. If you're not sure, those are all excellent things to do in my opinion. Research is always a good thing in my opinion. Now, let's say the patient is now unsure they're still having anal fissure issues. You know what I mean? There is a question mark. Some days I'm good, some days not so good. But for one thing, it just doesn't seem to go away. I agree. I think that's a time to come back and be examined. maybe like 6 weeks to 8 weeks. Maybe it's going to be 3 weeks for some people. I leave it up to the person's judgment to know. And of course, the patient always knows their body best, right? So when I examine you on your next visit, I look at the fissure again. I can tell if the fissure is getting better. Yes, I can just by looking at the cut. There are signs that a wound is improving and healing and improving. If I see those conditions, am I going to do surgery? No. Am I going to prescribe another medication? No. Your body is doing it. Let it go. Let it be the body and heal it naturally, right? There is nothing that I can do that your body will not be able to provide on its own. And I reassure the patient, say, hey, you're doing awesome. Keep it up. If you feel like things are still the same again, come back to me and yes, we will evaluate further. Now, what about the other situation? Let's say the fissure is definitely not moving anywhere towards improving. It's just festering, or maybe it's even getting worse. What do we do then? Now take heart, it is definitely not over for you and your body. Your internal anal sphincter likely has some spasm issues, and I've talked about this many times in other videos, where your internal sphincter muscle that controls your poop is squeezing way too hard at a very high force for a very long period of time. It has gotten to the point where it has learned that the world is a very dangerous place and it needs to squeeze and defend itself constantly. It keeps getting the harsh poops and it feels the pain just like you do and therefore reacts and shuts itself down. Now with that high tension in that muscle, it makes sense that every time you poop, the poop comes out and scrapes against that muscle. That's what keeps the fissures open. And I get it. At that point in time, people are becoming anxious, depressed, stop eating, become irritable, losing sleep. All of these types of things start to build on each other, and you can see the problem begin to snowball. And so we've got to take another step here. And what I think is appropriate is pelvic floor physical therapy. And I've got some videos on this, so I'm not going to go into detail. But the physical therapists are experts at the connective tissue, muscle tissue function of the pelvis. We're talking about urination, pooping, and the complex contractions and coordination that is necessary. How about reconditioning? How about stretching? How about exercising? You get what I'm saying. I am not a professional physical therapist, nowhere near it, but these are the people you need to see to be evaluated and then have a plan of action to treat these muscles. They're not supposed to be squeezing and freaking out like that all the time. Another aspect is talking about what may be contributing to your anus acting up, right? Squeezing hard. Now I understand many people will be very frustrated about how long it takes for the anus to recover, how long it takes for things to improve. I totally get it, but you have to understand another thing. The anus is a very, very sensitive and fragile body part. It has poop that slides by it and scrapes the inside. I mean, if you were a tissue paper, you couldn't stand up to any of that abuse. And the gut intestinal lining is very, very sensitive. We have to be very empathetic of it. Now, of course, everybody's different, like I said, so there's some special situations that I've run into that have helped some people. Okay, so first thing are sentinel piles. Sentinel piles are that extra growth of skin that feel like a hemorrhoid, but it's actually like this piece of scar and tissue that's stretched out over time because of the inflammation from the cut. But people can find these things so irritable and so painful every time they go poop that I actually remove it for them. Yes, I know the fissure is there. I'm making yet a bigger one by cutting this piece of skin off by the fissure. But I have been surprised over and over again about how people were healing their chronic anal fissures after that sentinel pile was taken off. Can you believe that, guys? I mean, it just shows we don't know the world 100%. but I was able to make a bigger benefit to the patient by removing that piece of skin. And the patient now can heal the wound because there isn't that crazy pain when they poop anymore. Another special situation is infection, or that fissure into fistula situation. There are people that have increased drainage like pus. That is not normal for an anal fissure, okay? It is not normal. There is something not right. There is some pocket where there's pus festering and collecting. In my opinion, that needs to be cleaned up in the setting of surgery.
Why do you need to do something so drastic, Dr. Chung? Come on, you can't just kind of open up in the office.
Yeah, I could cut some skin and try and do my best to open things up. However, these infections like to tunnel themselves underneath the skin in places that you wouldn't expect. So while people are asleep, I am inspecting and probing all around that infection area to make sure I uncover all cavities, all spaces where the infection may hide. Now, I'll argue with this type of infection surgery, you need intensive wound care. I see my patients about 2 to 3 times a week initially, and that's to make sure that this infection hasn't come back, okay? I have seen the scenario where within a week, a patient will have closed the wound back up, and that is very, very bad because the infection will come right back. Many surgeons, and it's not their fault of their own, I was trained the same way, will see your patient after surgery in 4 to 6 weeks. And then if the infection is there again, it's like, oops, oh well, we knew this was gonna be tough, right?
Oops.
And to me, I'm sorry, that's not acceptable.
Unacceptable.
I see my patients often because of the fact that I've seen these reoccur so early. And if you can get the proper wound care, yeah, we can heal these things and make it gonzos. Finally, when all else fails, no matter where you are in the flow diagram of my treatment, there is a last resort, and that is Botox injection. Now, Botox injection is a very commonly done procedure for anal fissures. It's on the internet, it's nothing new. However, the way I inject Botox and how much Botox I inject is completely different, and it's not described well in the literature on the internet. Yes, I've run across patients who are very complex, have had terrible anal spasm, terrible anal fissures, that has led me to create this procedure. And I'm sorry, it is not the same as what your doctor is doing. Because I've had the training, I've read the literature, and it is not the same. What I am doing is injecting this medication into your internal anal sphincter and your pelvic floor. These are the muscles that are unconsciously controlled, making your pooping life hell, and also, of course, making your fissures be recurrent and also refuse to heal. Now, this Botox procedure is relatively new, but I'm seeing excellent results with it. I'm talking about using it in the context of hemorrhoidectomy surgery, whether it's laser is used or not. I'm also talking about fissure infections or chronic fissures that just refuse to heal, even with pelvic floor physical therapy. I'm not sponsored by Botox, but I will tell you that this stuff works absolutely awesome with the way that I've been implementing it. And so as the patient is flowing through the diagram here of my plan, I've seen so many success stories, and it's truly been inspirational. And believe me, people have and are suffering just like you are. They can be so bad that they don't allow you to work or spend time with the family. It is incredibly a big problem with a huge spectrum of symptoms. And I want to let you know that you are not alone in this issue and in this fight. So I thank you for your attention. I hope this plan makes sense to you, and I hope you're able to be successful with it and heal your own anal fissures. And I'd like to give a shout out to Revival XR, the sponsor of this video, once again, because yeah, you can heal your anal fissures with sitz baths as well too. The 20 natural ingredients in here are what I love when I get my own anal fissures and hemorrhoid issues and itching issues. This is a comprehensive sitz bath supplement that you can use just 5 or 10 minutes in the bathtub. and use this on a daily basis. Thank you so much, Revival XF, for the discount coupon. Everybody, go ahead and use it. It's on Amazon. I'll see you in the next one. Bye-bye.